Hey Corey, how are you?
Hey, I'm good. I'm good. How are you?
I'm good. Happy Friday.
Yeah, the weeks have been flying because of because of warm outside. I guess.
Finally. Although we had so much rain this week.
Yeah, but I think it's been kind of backwards. Like it's kind of like we've been getting rain showers this month instead of in May. Or how does it go? May
Yeah,
flowers,
May was rainy. June was
spring May
pretty rainy
flowers.
compared to April.
Yeah, it was pretty rainy, but hey, I guess it all works out.
Yeah. Just going to get Whitman-Walker in the room and then we'll get started, everyone. Hope everyone's despite the news this morning of Roe versus Wade being overturned, hope everyone's having an amazing morning and day thus far.
I think we need to do a live on that to like, yeah, I don't. It's crazy.
Mm. At least 26 states are expected to, enforce the overturning of Roe versus Wade almost immediately or as soon as practicable for them, which means anyone who was scheduled to have an abortion, this week, if you will, um, now finds himself in a very difficult position of having to get funds and figure out what the next closest state they can travel to access this life-saving and life-changing procedure.
Yeah, and I just don't understand how, like what do you guys plan to do with all of the children that are going to be forced to put in the world?
Definitely
Like,
not support them.
right, like what are y'all planning on doing with these children? Because the orphanages are already hard. Like, I don't get it, but that's what's supposed to be happening. All
Yeah.
right. Yeah, so I guess we can go ahead and get started, Jewel.
Yep. Hi, everyone. My name is Jewel, and I use she, hers pronouns. And during the past few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you.
Hello, everybody. My name is Corey. Today we will be covering Klinefelters Syndrome. Um, this is brought to you by NHS.com. They cover a lot of different things when it comes to scientific studies, but it's brought to you by NHS. We can go ahead and get started.
So today we're discussing Klinefelter syndrome, and the Klinefelter syndrome is sometimes called Klinefelters, KS, or XXY. And this is where boys and men who are assigned male at birth uh, are born with an extra X chromosome. Chromosomes are packages of genes found in every cell in the body, and there are two types of chromosome called the sex chromosomes, and that determine the genetic sex of a baby. These are named either X or Y. Usually, a baby who's assigned female at birth will have two X chromosomes, and a baby who's assigned male at birth will have one X and one Y chromosome. But in Klinefelter syndrome, a baby who is assigned male at birth is born with an extra copy of the X chromosome. So their makeup would be XXY versus the normal XY, or XX if it's a baby who's assigned female at birth. The X chromosome is not a female chromosome and is present in everyone. The presence of a Y chromosome denotes being assigned male at birth. Boys and men with Klinefelter syndrome, or people who are assigned male at birth with Klinefelter syndrome, are still genetically male and often will not realize they have this extra chromosome, but occasionally it can cause problems that may require treatment. And Klinefelter syndrome affects around 1 in every 660 people who are assigned male at birth.
So some symptoms of Klinefelter syndrome. Klinefelter syndrome does not usually cause any obvious symptoms in early childhood, and even the later symptoms may be difficult to spot. Many boys or men or people that are assigned male at birth do not even realize that they have it. Possible features which are not always present may include in babies and toddlers learning to sit up, crawl, walk, and talk later than usual, being quieter and more passive than usual. In childhood, shyness, low self-esteem, problems with reading, writing, spelling, and paying attention, mild dyslexia, um, or dyspraxia, low energy levels, and difficulty socializing or expressing feelings. In teenagers, growing taller than expected for the family with long arms and legs, broad hips, poor muscular tone, and slower than usual muscle growth, reduced facial hair, and body hair that starts to grow later than usual, a small penis and testicles, and enlarged breasts, are also known as gynecomastia. In adulthood, there's an inability to have children naturally, so they're infertile, and they have a low sex drive in addition to physical characteristics that I mentioned above.
So health issues in Klinefelter syndrome, most people who are assigned male at birth or boys and men with Klinefelter syndrome will not be significantly affected and can live normal, healthy lives. Infertility tends to be the main problem, although there are treatments that can help. But men with Klinefelter syndrome are at a slightly increased risk of developing other health problems, including type 2 diabetes, weak and fragile bones or osteoporosis, cardiovascular disease and blood clots, autoimmune disorders where the immune system mistakenly attacks the body, such as lupus, an underactive thyroid gland, also known as hypothyroidism, anxiety, learning difficulties, and depression, although intelligence is usually unaffected, and finally, male breast cancer, although this is very rare. These problems can usually be treated if they do occur, and testosterone replacement therapy may help reduce the risk of some of them.
Causes of Klinefelter syndrome. Klinefelter syndrome is caused by an additional X chromosome. This chromosome carries extra copies of genes which interfere with the development of the testicles and mean that they produce lower testosterone. So, lower testosterone, of course, is the male sex hormone. So, with people that have Klinefelters, the extra X chromosome makes them produce a lot less testosterone in their blood. The extra genetic information may either be carried in every cell in the body, or it may only affect some cells, known as mosaic Klinefelter syndrome. Klinefelter syndrome is not directly inherited. The additional X chromosome occurs as a result of either the mother's eggs or the father's sperm having the extra X chromosome, as an equal chance of so basically there's an equal chance of it happening from the mother or father. So after conception, the chromosome pattern is XXY rather than XY. This change in the egg or the sperm seems to have um, to happen randomly. So if you have a son or with the condition, the chances of this happening again are. But the risk of a woman having a son with Klinefelter syndrome might be slightly higher if the mother is over 35 years of age.
So testing for Klinefelter syndrome, yeah, you should definitely see your general practitioner if you've got concerns about your child's development or you notice any troubling symptoms of Klinefelter syndrome in yourself or your child. Klinefelter syndrome is not necessarily anything serious, but treatment can help reduce some of the symptoms if necessary. In many cases, it's only detected if a man or someone is assigned male at birth with the condition undergoes fertility test. Your general practitioner may suspect Klinefelter syndrome after a physical examination and may suggest sending off a sample of blood to check reproductive hormone levels. The diagnosis can be confirmed by checking a sample of blood for the presence of the extra X chromosome.
Treatments for Klinefelter syndrome. There is no cure for Klinefelter syndrome, but some of the problems associated with the condition can be treated if necessary. Possible treatments include testosterone replacement therapy, speech and language therapy during childhood to help with speech development, educational and behavioral support at school to help with any learning disability difficulties or behavioral problems, occupational therapy to help with any coordination problems associated with this dyspraxia, physiotherapy to help with muscle and increase strength, psychological support for any mental health issues. Fertility treatment options include artificial insemination using donor sperm or possibility of um, intractoplasty, intractoplastic sperm injection or ICSI, where sperm removed from during a small operation can be used to fertilize an egg in a laboratory, as well as breast reduction to remove any excess breast tissue.
So testosterone replacement therapy involves taking medicines containing testosterone. It can be taken in the form of gels or tablets in teenagers, or given as a gel or injections in adult men. TRT, or testosterone replacement therapy, may be considered once puberty begins and may help with the development of a deep voice, facial and body hair, an increase in muscle mass, reduction in body fat, and improvement in energy. There is also evidence that it can help with learning and behavioral problems. You should see a specialist in children's hormones or a pediatric endocrinologist at this time. Long-term treatment during adulthood may also help with several other problems associated with Klinefelter syndrome, including osteoporosis, low mood, reduced sex drive, low self-esteem, and low energy levels, although it cannot reverse infertility. Thank you all for learning a little bit more about Klinefelter syndrome today. I
Yes,
know I learned a lot.
it's definitely one of those things that I don't think a lot of people realize that's there, but it is. But before we go, we want to give you a few reminders about COVID-19 and the vaccines. If you've already got vaccinated, congratulations. Of course, you've taken a really important step to preventing your loved ones and your communities from illness. Variants are soaring across the United States at the moment. It is totally understandable why you might not, why you might want to keep wearing your mask. The vaccine is not 100% effective. More contagious variants are spreading, and there are very few protocols in place to actually verify that folks around you are vaccinated. Please keep staying alert. If you haven't been vaccinated and you're looking for an appointment, here at Whitman-Walker, they have COVID-19 vaccine available. Everyone is eligible. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us for DC residents, you can find more information on vaccination walk-up locations and eligibility at vaccine.dc.gov or by calling 1-855-363-0333. For Maryland residents, learn more about the Maryland vaccination distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. For Virginia residents, learn more about the Virginia vaccination distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to make sure to follow CDC's guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you get the vaccine, discuss COVID precautionary measures with those around you, be mindful of masks and keeping your distance, especially when you're not sure if a person has been vaccinated or not. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker and continue to keep checking our website at whitman-walker.org for the most up-to-date information on our services and for more COVID-19 resources and general Whitman-Walker services. Please call us at 202-797-4439. You can, of course, follow some more of our programs and Whitman-Walker family at Real Talk DC _ and at No Filter DC. Everybody have a safe weekend. We're coming up to the end of Pride Month, so still be prideful in these last few days and for the rest of the year. Um, but be safe for sure. Take precautionary measures. It's been a lot of shootings and chaos here in DC, so make sure that you're watching your surroundings. Yeah, and just be happy. Happy Friday.
Happy Friday, y'all. Bye.